Hey, it's Dr. Fanistil at BoulderMindBodyMedicine.com. I want to talk today about nerve pain. I got an email from a woman who's taking a class of mine. I've never seen her one-on-one, but she had a very good question. And she said in her email, I have one area of pain that I'm curious about your thoughts on. I have a very painful scalp that has been diagnosed as scalp dysesthesia. And then she says how it's been happening for 10 years. It hurts to touch the scalp. Sometimes it hurts just for her hair to move. And she describes a burning sensation that can be quite severe. And then she says, I would like to believe that this is neuroplastic, but there is some doubt for me. The pain is pretty persistent and consistent. And she asks, have I had success with other patients who've had this nerve pain? The first thing I want to say here is, this sucks. Nerve pain sucks, and I'm sorry for her. I'm sorry for any of you who are out there dealing with bad nerve pain, maybe labeled neuralgia or neuropathic pain. But these pains can be very severe, very significant, and life impacting. So I really feel for you if this is happening to you. Number two, great question. Because what you've identified, what she's identified in asking this question is this very important question about, is this pain really neuroplastic? Am I even on the right path pursuing these mind-body tools? All right, let's break this down. First, dysesthesia, scalp dysesthesia. Dysesthesia is not a diagnosis. Dysesthesia means dys, which is uncomfortable or not right. Aesthesia means sensation. So we've got an uncomfortable sensation. That's not a diagnosis. What's just happened there is you came into the office and told the doctor, I've got a funny sensation on my scalp that's often uncomfortable or painful, and the doctor turns that into Latin, calls it a dysesthesia, and oh, we've made a diagnosis. That's not a diagnosis. That's a description of what you had in a different language. That's all it is. No, if you come to a doctor with chest pain and they do some tests and say, oh, you have a occlusion of your left anterior descending coronary artery, we should put a stent in there. Now we got a diagnosis of coronary artery disease. You came in with chest pain, you leave with a medical diagnosis. If you came in with a nerve pain and you left with a Latin term for your nerve pain, pudendal neuralgia or something like that, you just left with a description in a different language. And now we're in the realm of diseases or disorders that usually respond to mind-body medicine. Because what that means is Western medicine hasn't identified the exact cause of the problem, so we just turn it into Latin to make you think we know what we're talking about. We don't know what causes these nerve pains, or we didn't until we started understanding the new pain neuroscience of neuroplastic pain. Let's go back to our basic understanding about the new neuroscience of pain. All pain is in the brain. This is true when I step on a sharp object. The nociceptors in my foot send a message to the brain, which does a little quick analysis and goes, heck yes, we got a problem here, and then says, yeah, keep on firing. In fact, fire harder. It sends a message back down, letting me know that I'm in trouble. And I usually am. I look down, I find something, and I take care of it. What we have to remember is that in chronic pain, once you've done the due diligence to make sure you don't have, underlying bone cancer or some real terrible disease here, and you're left with a diagnosis of neuralgia of some sort or dysesthesia, then you've done the due diligence. You don't have a physical medical problem causing this. You have a nerve that is continuing to fire. Nerves fire because the brain is telling them to do so. Nerves fire because the brain has gotten the message from them and has decided to allow it to go on firing. You can teach these nerves to calm down. I had a woman once with peripheral neuropathy. This is painful peripheral neuropathy in both her feet. She was on high-dose gabapentin. She couldn't sleep at night without a high dose of that drug. And she was miserable from this. And I remember seeing her. She had actual nerve conduction tests saying that the nerves were mildly abnormal. She was in her 60s, I think. And on my exam, I put my tuning fork on her toe, and she couldn't feel the vibration sensation. She had lost vibration sense in these nerves. And I remember telling her, look, I'm not sure, I don't know that you can bring the vibration sense back to your toes. These nerves may be not functioning correctly, but the pain, that's in your brain. And sure enough, she took care of her pain by using these mind-body tools to reteach her brain not to interpret these signals in a dangerous way, using tools from pain reprocessing therapy and somatic tracking and calming down the hypervigilance in her autonomic nervous system. Interestingly, she came back 4 years later and said, yeah, my pain's been gone for 4 years, but I'm still stuck with some anxiety. and some fatigue. And then we moved over from the pain reprocessing tools like somatic tracking, and we moved into the under the hood tools, getting at the emotional issues. And she's had marvelous success now with anxiety and fatigue, looking at her emotional stuff under the hood. But that's a little sidelight. The prototype nerve pain is phantom limb pain. Here's somebody who's unfortunately had an amputation and they still have pain in their foot. Where is that pain coming from? It's coming from the brain. They have foot pain, but they don't even own a foot anymore. Obviously, that's coming from a brain. This is the same type of thing that's happening in most of the neuropathic pain I see. And I think it's more appropriate to call it neuroplastic pain. Plastic means it's changeable. Pathic means it's diseased. I don't think it's diseased. There's no disease happening in these nerves. There's some abnormal signals being sent or some unnecessary signals being sent. And when that's the case, oh, well, all neural signals, all neural circuits are changeable. It's called neuroplasticity. My main message here today is if you have a neuralgia or a dysesthesia or some sort of Latin word for your nerve pain, yes, you are on the right track using mind-body tools. And you may have in your head, based on what somebody told you, some understanding about, oh, we did an MRI of the pelvis and we can see a nerve getting pinched or something like that. My experience is that nerves don't get pinched in soft tissue, or if they do, it's from muscular tissue that can be relaxed. If there were actually like a bone or something really firm that was actually really compressing a nerve, we could get in there and decompress it. That's not happening, or you would have had such a procedure to decompress this nerve. So even if you're carrying that story about a nerve being pinched, I would challenge you to think about this differently. You've done the due diligence. You've made sure that you don't have some serious problem that Western medicine has an answer for. Now it's time to start training your brain to reinterpret signals coming from this nerve as non-dangerous. And this is the whole essence of neuroplastic retraining therapy, whether you're doing pain reprocessing therapy or whether you're using what I think of as under the hood tools to get at the emotional things that are keeping the brain hypervigilant. And there are different ways and different approaches for different people. Everybody kind of needs to figure themselves out here. But you're on the right path. I'm sorry if this is happening to you, because neuropathic pain is very severe. It can be very severe and often disabling. And this just gives me the opportunity to remind you that a lot of times neuroplastic symptoms, brain-generated symptoms, are some of the most severe symptoms I see because they don't have an easy medical answer. These are really severe symptoms. And when I say they're coming from brain circuitry, this is not in your head. Your brain controls your body. These are circuits that developed outside of your conscious awareness. And your brain got hypervigilant like this, usually for a reason. And you don't have to do a bunch of psychotherapy to figure out the reason. You just have to acknowledge, oh, this is how brains work. And you have to acknowledge that my brain is doing this and it's not your fault. That's an important part of getting better here. And I like to mention that, and I've mentioned that in other videos. All right, I hope that helps some of you who are dealing with nerve pain and maybe reconfirms your commitment to this is the right way to go. Really important to have that level of confidence that this is something I can do because this is the treatment for most of these kind of pains. Thanks for watching. I'm Dr. Fanna still at BoulderMindBodyMedicine.com. See you next time.